What's up, guys? You're watching the Crammable King right now. And right here we have, let's get right into it. So, this is a mnemonic of the peas. And I feel like you guys should know this because it's just important to know some important stuff that might pop up on your exam. So, let's get right into it. So, the first one is ape. What's ape? It's actually acute intermittent porphyria. Um, this is a disorder in heme breakdown. So, this is a disorder in heme, making heme. So, heme is required for hemoglobin, and this is heme is basically has a lot of cytochromes in it. So that's why it's precipitated by cytochrome P450 enzymes. So anything that affects those enzymes mostly stimulates those enzymes, because when you're stimulating these enzymes you're going to be making more heme. Okay, so there's a mnemonic I have for that. I'll be covering in another video. I'll put a link there. And so this is autosomal dominant, most commonly presents in females with painful abdomens. That's what you guys should know, right? That's important. So this is most commonly in females with painful abdomen. They complain of that they have a lot of pain in the abdomens, and that's because of all the metabolites of the precursors of heme being built up, because you have a deficiency of porphinobilinogen deaminase, which is a cytosolic enzyme. Okay, for your exam, you guys should know all the mitochondrial enzymes and cytosolics. Well, there's a lot of cytosolic enzymes of heme synthesis, but there's only two that are not cytosolic, which is synthase, the first enzyme, and the last enzyme is ferrochelatase, and the rest is the rest. So, you have the first P is polyneuropathy, right? They have a lot of nerve problems. Maybe they're tripping a lot. They can't feel certain sensations, right? They have ulcers on their feet, stuff like that. Nerve problems. And then psychiatric problems. Maybe they're going crazy. Maybe they have schizophrenia, depression, mania, cyclothymia, some type of problem that tells you that person is crazy. And port wine color urine basically means that the urine literally looks like it's the color of wine, like the dark wine, and this occurs after standing. Like the person goes to the toilet, right? He goes urinates, he takes a piss, but then forgets to flush it, and then the next day when he tries to flush the toilet, maybe even hours later he tries to flush the toilet, but then he notices it's really dark colored and precipitated by P450. Like I said, I'll be discussing in that in another video. So that's the first P's are done. So let's check this off. Okay, and then the second one is compartment syndrome. So compartment syndrome, what it is that inside your muscles have compartments. When you talk about compartments, we usually talk about limbs. So your arms have anterior posterior compartments, your legs and your thighs have anterior posterior compartments, and those compartments are basically sections inside your legs that have certain nerves, arteries, and veins in them, and they're surrounded by muscle and fascia. So when you have a syndrome of the compartment, you're gonna have problems with the nerves, arteries, and veins in there, right? So some of the symptoms are pain. Is very painful when you occlude the blood flow, and then you get ischemia distal to that, and you have paresthesia because you're affecting your nerves. You have pallor, you have paralysis, and then you have polochiothermic. What is that? That basically, it literally means that your skin feels like it's the skin of a reptile. It's cold-blooded skin, so it feels really cold. Why? Because you stop the blood flow. Okay, that's compartment syndrome. Acute interstitial nephritis, a little bit about this, is the interstitium of the kidneys are being infected or inflamed. And this what happens here is that it's a type 4 hypersensitivity reaction. Mostly it's a type 4, and they're precipitated by a lot of drugs, but I feel like these are the most important ones you guys should know. So NSAIDs you should know about. Any NSAIDs can cause this. and this usually presents within 3 to 4 days or maybe even a week after the person starts a drug, and then they get kidney problems. You should think about this. Start a drug, get a kidney problem. So P refers to diuretics. So let me just put that here. Diuretics, penicillins, all types of penicillin, including cephalosporins. Then rifampin, which is used for chemoprophylaxis for certain types of bacteria infections, and also this is one of the things that revs up your cytochrome P450, and also is used for tuberculosis. PPIs, proton pump inhibitors. I emphasize the two P's. Any proton pump inhibitors can cause, any sulfonamide derivative drugs can cause this. Okay, so that's that. Let's check these two off. Boom, boom. Okay, so Lichen Planus. You guys should know about Lichen Planus, and you guys should know also how it looks. So you guys can just Google this, because I recommend you guys Google this because it's more active learning. You guys are just gonna learn a lot if you just do things yourself, figure out, solve your own problems. So Lichen Planus, the planar means that it's flat. Polygonal means that it can be in any shape. It can be like any shape. It doesn't have to be rectangular. It can be any shape like this. Understand? So that's what it means. Pruritic means that it's itchy. Purple, it's purple. Penile, which means that it could be on your penis or vulva. Depends. That's only sometimes, but that's there too. Plaques, which means that it's a big papule. Okay, it is. I think it's over 6 centimeters. Papules is basically a small plaque. It's an elevated lesion under 1 centimeter. Sorry, plaques is over 1 centimeter. Papules are under 1 centimeters. Arterial thrombosis, it's similar to compartment syndrome, except you're only affecting the artery. So you're gonna have pain again. You're gonna have pulselessness, pallor, paresthesia, and paralysis, because the nerves also require blood flow. So that's why you have these last three, and then pulselessness and pain because the arteries are occluded. Anal fissures, you should know for the exam, because they'll probably present Crohn's disease, and the Crohn's disease usually gets anal fissures on the exam. So what anal fissures are is just a tear in the mucosa of the anus, and how it presents is this is how it presents with this mnemonic. It's usually posterior. In the posterior anal canal, is usually posterior medial. I didn't put that here, but let me put it. It's posterior medial in the anal canal, because that area is the most poorly perfused area. You have pain while pooping, and you have while cleaning your anus, you have paper blood, which means that there's blood on the tissue paper, and then below the pectinate line. I wrote this in because the P, just go down and put an arrow like that, which represents that it's below the pectinate line, which means that you guys should know the nerves, arteries, and veins supplying the area below the pectinate line. So the nerve would be the pudendal nerve, and then the artery would be the pudendal artery, and the vein would be pudendal vein. So it's different from above the pectinate line. Alright, that concludes this section. So those are the P's. The link to this mnemonic will be in my description, and hopefully you guys learned something. Take care.